Hello and welcome to Health Matters on Channels Television. Thank you for joining us. I am Mary Alale Yusuf. Now, oral health is a state of being free from chronic mouth and facial pain, oral and throat cancer, oral sores, birth defects such as cleft lip and palate, gum disease, tooth decay and tooth loss, and other diseases and disorders that affect the oral cavity. It's a whole package. Today we look at oral, or what we call mouth ulcers, which are sores occurring anywhere in the mouth. Up to 25% of the population is affected by the most common oral ulcers, which are sometimes recurrent, and women are more affected than men. My guest is a consultant oral physician at the Lagos University Teaching Hospital and the College of Medicine, University of Lagos. She's Dr. Tola Eweka. Olutola Eweka. You're welcome to the show.
Thank you. Nice to be here.
Okay, now, that's a whole lot of things that, involve oral health. Are they all in the purview of the dentist?
Yes, basically. But usually there could be relationship with other people like dermatologists, where we have oral ulcers that affect the skin. Then you also have some that would, apart from the skin, we have the eyes, so we bring in the ophthalmologist. So it's a multidisciplinary approach to a particular condition that presents along with oral ulcers and then other systemic conditions.
Okay, now, I imagine that pain would be an obvious symptom of an ulcer, an oral ulcer. But are there other symptoms that come along with it?
Basically pain. Pain will disturb speech, will disturb eating. So the patient finds it difficult to that way, they lose weight. And of course, patient now begin to feel weak. And then there could be other symptoms associated like fever. The patient is feeling sickly, which we call malaise, and the other things. But basically, pain is a major thing. And that's what affects everyone.
But it's sometimes serious enough that a person loses weight?
Oh, yes.
Find it hard to believe that oral sore will make someone...
If you can have a sore that will last for a month, that patient is not eating. And then when they don't seek for help, that could actually just cause them to emaciate, and they lose a lot of weight and all that. So, and then that could set an infection as well. So it's a multiple effect.
Are there people who are more susceptible to these ulcers, or do they just occur to everybody?
There are some people that are more susceptible where there's a genetic disposition, particularly when you start seeing ulcers in children. Then their parents have had it, or some family that has a genetic disposition. So that makes them susceptible to it. And there's some people that cannot bear stress. The two of us can be doing exams, and some people, they are down during exams, and then others are just up and they are okay. So all that plays a role in the susceptibility of the patients to oral ulcer.
Okay, some people have, actually told me, they open their mouth and they say like, look, can you see it's sore there, And it's just this little, small white thing. Most people just ignore it. It goes after a few days. Is it something that one should actually be bothering about?
Well, if we are going to see all the patients that have oral ulcers, then we will not do any other thing.
There are that many.
Yes.
Okay, now look at this one, for example. Just a little white spot there. Should this person be seeing you?
This patient should, because it has multiple oral ulcers.
All down the lips there.
Where we have multiple oral ulcers, you should actually go seek for help. Then particularly when it is recurrent. Some people may have a one-off thing. Maybe they are preparing for their wedding, they are stressed, and then the thing goes after the wedding, they are fine. But some people, it's a recurrent thing. So the idea is to seek for help to break the recurrence. Not because you cannot do warm water and salt at home and the thing heals up, because it will go through its course. But you can seek for help to aid the healing. That will help the healing of the ulcers. And of course, we want to break the cycle of the frequent recurrence.
I'm interested in that. You said break the cycle. So this is something that can be broken.
Yes.
Somebody keeps having this ulcer time and time again. When he visits the dentist, mind you, for something on the lip, you can actually do it so he doesn't have it anymore.
Yeah. What are we aiming at? We're trying to get the cause. Once you can get the cause, then you can break the cycle. Assuming the patient is reacting to pineapple and they don't know. When we interact and we find out, oh, this pineapple is the problem, immediately you stop eating the pineapple, patient is fine. So particularly for the ulcers that are caused by reactions to something, once you stop it, example, septrin, once you stop that drug or you don't take it again, the cycle is broken. But if you don't know, you keep using it and the thing keeps coming on and off, you know, that's why you should visit a dentist. One of the reasons.
Okay, now, as a patient, should the person know whether a particular ulcer could pose a danger or whether he should ignore it? You know, because like you said, if you get to see every person with an oral ulcer, you probably wouldn't do any other thing. So do they have like signs to show that, okay, this looks serious, or let's forget about it, it'll be gone?
Let's look at the ulcers. There are different kinds of ulcers. Now, if you look at children, we have the ones caused by the viral infection. It's multiple. Those ones should seek help because the child will not be able to eat.
The ulcers come in groups.
It comes in groups. They're quite a number. When you have plenty ulcers, more than one or two, you should seek for help. When you have it coming frequently, you should seek for help.
How frequent is frequent now?
It depends. Frequently means, when you talk about something that comes once a year, if it's just one tiny ulcer once a year, I probably wouldn't bother. But you have like 5 that comes every month, or before one heals, another one has come. That's what we call frequently. You shouldn't have ulcers normally. So if you have it, then you should be worried, particularly when it starts coming frequently. Or you have big ulcers. You have a very big one that is there. It will not heal in like a month. So you need to seek for help. Now there are some ulcers that could be there for 3 months without pain. Those are very dangerous ulcers.
Are those the ones they call cold sores?
No, cold sores are the Aphthous ulcers.
Okay.
Those ones that stays for 3 months are those ones tending towards carcinoma. That's cancer.
How does a person know there's a sore that they don't feel?
Everybody knows, even though you cannot see the back of your tongue, you know there's something there. You should ask, go and seek for help.
And once it's not painful, red flag.
In fact, so people have these patterns on their tongue we call geographic tongue. It's not painful. But some people come and say, I noticed this thing on my tongue. I want to do something about it. So you should actually see the dentist. It doesn't take more than your consultation fees. But that could save a life. If the patient has an ulcer that is not paining the patient for a month, that is red flag. You should biopsy that ulcer to be sure it's not a cancer. So those are the things we all look out for. So we must seek for help.
Okay, now you're mentioning different areas of the mouth. Where do these sores actually come? Apart from the lips, you've mentioned the lips,
yes.
You've mentioned the tongue. Any other place?
We have the tongue, we have the floor of the mouth under the tongue, we have the lip, we have the buccal mucosa, that's the inside of the cheeks. Then we have the roof, which is the palate. It could be anywhere in the mouth, and it could be on the face. It could involve the eyes, it could involve the skin, it could involve the whole body. In that one is no more oral ulcers. Mm-hmm. That's now a systemic thing where we have other people coming in to manage that patient.
Okay, you spoke about reactions to drugs. Where do they usually get the first sign? Sometimes it's in the mouth, sometimes it's on the eyes, in the skin. Where do people usually get the first sign?
It depends. The mouth may be the last to present. Usually, either the mouth or the eyes. And sometimes it may not even involve the eyes at all. It could be only the skin. Sometimes it's just the skin, doesn't involve the mouth. It all depends on the patient. Everybody is different. So I have a patient that when this thing started, it started with the eyes only. I had another patient when it started, it was only the lips. It wasn't even inside the mouth, just the lips. So particularly when it comes to drug reactions or allergy to food, there's some people that react to okra. I had a patient that reacted to a certain fish, and he was eating this fish for 15 good years and he kept having the ulcers. But he never knew until one day we asked him, in fact the whole tongue was destroyed. One day we asked him, so what allergies do you have in your family, what food taboos? And he said there's a certain fish we don't eat, but I like to eat that fish. The moment he stopped eating the fish, this man was free. So you need to look at yourself. What do you eat? What do you drink? What are the drugs you take? Some people react to different things. It can be an infection that is causing it. Then most importantly, apart from infection, is stress. Stress causes a lot of...
Okay, maybe I'll talk about the stress later, but I really need to know about this fever blister. There's something people usually get right at the corner of the mouth usually, and they say, oh, you know, you're really strong, you just fought off a malaria attack, or you're about to get malaria, you need to get drugs. What's that blister all about?
That has nothing to do with malaria. People call it, I'm just overcoming malaria. That means they're not down with malaria. That is not true. It's a misinformation.
Okay, that's what we are looking at on the screen now.
Yes.
It looks just like that fever blister.
Exactly. So what usually happens is that there's a primary infection that had occurred in that patient as a child. This primary infection would have caused ulcers all over the mouth, and the etiological factor, that's the organism involved, is a virus we call herpes simplex.
Isn't that really dangerous? Because we've heard of this virus in connection to sexually transmitted infections?
Yes, it's the same virus, but there are different strains.
Okay.
The one in the mouth is the type 1. The one in the genitals is the type 2.
Okay.
Now, for the type 1, that will occur in children where there's malnutrition, or there's maybe child is going through some form of stress, or maybe the immunity of the child is low. Those can bring up those kind of viral infections. Now, the ulcers heal, but the viruses stay latent, quiet in the trigeminal nerve. When there's a sparking up, maybe a stress factor, maybe they're praying for common entrance, or they're praying for WAEC or JAM, or getting ready for their wedding, anything that will bring stress, or maybe it's bereavement, emotional disturbances, maybe a person just went through a breakup, a divorce. Those are stress periods. The immunity drops, and the virus is reactivated, and it comes out as what we call herpes labialis. So that's what we see, and that's very recurrent. No, so the primary infection is in the child. The secondary infection keeps going and coming when there's reduced immunity.
Now, here's what I want to know. If somebody catches that kind of thing, I mean, by catch, I mean a parent notices such a thing, should that child be treated for that thing to go? Can it go? Can it be dealt with?
Yes, it can be treated, although usually we just give vitamin C, multivit, just improve the immunity of the child.
So it's a matter of boosting the immunity.
If you want, you can come to the hospital, fine. If you're not so, people are not, really, we advise that they come to the hospital, really, because sometimes it can be severe. And then you can also prevent it. We educate the parents and tell them, oh, maybe that child is low in the nutrients and all that. We educate so that we don't get frequent recurrence. But nevertheless, it's going to dry up anyway within maybe 10 days or something. So what determines when they go to the hospital is the severity of the lesions.
So if there are complications of, say, fever, do they get such complications?
Now, there could be mild fever, and for a short period. That's where that fever blister comes in, and they feel it's malaria. Malaria is not the cause of all fevers. It's just maybe 1%, maybe 10%. So there are many other things that causes fever. And then viral infection is one of the key things. And herpes is one of the viruses. So
okay, now these blisters that occur time and time again, do they leave behind some unpleasant consequences? For example, you know, when something heals, there's a scar.
Yeah.
And then you have many healings, many scars like that. But let's go on a break. When we come back, you talk about that.
Okay.
We're about to go on a break. Stay with us for the answer to the question and much more.